I'm Jim Longworth, and welcome to another edition of Forsyth County Connections, coming to you from the studios of the Government Center here in downtown Winston-Salem. We appreciate you being willing to spend a half hour with us, and it's going to be a jam-packed half hour. We have some great guests, important information coming your way, and none more important than really starting out with this particular topic and a very special lady to help us through it. We're going to talk about infant mortality, and our special guest, the first-time visitor to the show, is Lasonya Tuttle, Coordinator of Health Services for Forsyth County. Good to see you.
Hi, thank you. Thank you for having me.
How do you define infant mortality?
Okay. Infant mortality is when a baby dies before they turn one, the age of one.
Well, what are the top causes of that? Now, I know there are horrible cases of abuse,
Yes.
that kind of thing. But other than that, what usually causes a baby to die before age one?
One is preterm birth, where the baby is born before age 37 weeks.
Okay.
So mom has the baby at 37 weeks or before, so it's
Okay.
preterm birth.
Right.
Another one is
We used to, in the old days, back in the 50s, we call them a preemie or something like
Preemie,
that.
exactly.
Okay, yeah, all right.
Another one is low birth weight. Like anytime a baby is 5 pounds 3 ounces, they consider that low birth weight. In
Right.
5 pounds 3 ounces and below.
Well, now, did I read something about a new grant program and something you're teaming up where it's Forsyth County and Guilford County working together? It sounds kind of innovative to me. Now, what's that all about?
Okay, yes. There is a new grant here in Forsyth County in partnership with Guilford County. It is called Improving Community Outcomes for Maternal and Child Health. And the acronym would be ICO4MCH.
Okay.
So with that grant, the aim is to reduce infant mortality and birth outcomes, and also children's health between ages 0 to 5 years.
Man, that's so important. What made you want to, I know the grant facilitated it, but it's pretty innovative that you're going to team up with two counties working on something. Usually we're all sort of busy doing our own
Right.
thing. Why did you want to do the two counties? Why was that a good idea?
Well, first off, Forsyth and Guilford County are in the top 5 with highest infant mortality rate in the state of North Carolina.
I did not know that.
Yes. Guilford County is 8.2 per 1,000 births. So that means 8.2 pregnancies
Right.
will end in a death.
Yeah.
Forsyth is 8.4.
I didn't realize it was that bad, and they both shared that horrible statistic. That's so
Yes.
sad.
So unfortunately, Guilford's rate went slightly down, so that disqualified them for the grant to do it alone.
Now, Guilford's been working on this for a long time. Are there any strategies that they've implemented in the past that you sort of took note of? You know how we all sort of compare notes and stuff. You know, how do you assess that?
Yes, there are strategies which we hope to replicate. So they're going to teach us for a couple of years to replicate what they did. They did they did triple P, which is positive parenting. That was one of the strategies they did.
Right, right.
They did a lot of social media.
That's important these days, especially because what your challenge is awareness and education, right?
Absolutely. And part of this grant, much of this grant will be education, outreach and education.
I mean, you cover all sorts of things like, look, folks, it's important to get good nutrition and just telling people
Absolutely.
you're really trying to get this message out.
Absolutely. So we will have community health workers working very closely with the community to get the word out.
That is so important. Now, is there a particular website or phone number or something if people want to learn more, and where should they go?
Right now, if they want to learn more, I will be the contact person for Forsyth County.
Okay.
So my phone number is 336-703-3189.
Okay, 3189.
Then after the launch of the grant, of course, it would be on Forsyth County website.
Okay.
If they want to know even more, they can contact Every Baby Guilford, which is in Guilford County.
Such important work that you're doing, and we could talk about it a lot longer if we weren't out of time, but I just want to tell you how much I appreciate your efforts and what you're doing. And
Thank you.
good luck with it. And come back sometime, let me know how it's going, will you?
I will.
All right, Lasonya,
All right.
thanks.
Thank you.
We'll be right back after this.
Medications taken as prescribed for you are safe. They should only come from a pharmacy or healthcare provider. Counterfeit prescription pills can kill. 7 out of 10 counterfeit pills tested by the Drug Enforcement Administration contain an amount of fentanyl that can be deadly. It only takes one pill, one time, to kill. One pill can kill. A message from the Forsyth County Behavioral Health Services.
Here you go.
Thank you.
Thank you.
It's before 8 a.m. Monday, and Katie Johnson of Public Health's Healthy Communities program is ready to get her hands dirty to feed residents who have few healthy choices. She digs into the plants, lifts the vines, and removes her harvest. Then it's on to the next one. She's harvesting from the 2 raised beds she planted for the Public Health Department and a program to address food insecurity.
So it actually comes from the Healthy Corner Store network. To be a part of that network, you have to have a certain amount of healthy foods in your store available. Once you get certified with the state, you become a certified healthy store.
Johnson worked with those stores to help set up the free produce program for public health and started growing fruits and vegetables here at the Simon G. Atkins Community Garden. The program is in place in areas where there is a lack of grocery stores and supermarkets providing a full variety of foods. They're called food deserts.
There's actually 21 food deserts in Winston-Salem, and the city is rated 7th on the food hardship scale. So that's pretty bad. So once I learned that, I figured we have to get more healthy food into the food desert areas.
Today's harvest is done.
It was a really good harvest today. I got about 2 pounds, 1.5 pounds of zucchini and half a pound of cucumber. So I think the store is going to be really happy when we deliver that today.
A quick trek across town to Jonestown Road, she visits Los Juanes.
Hey Juan, how are you?
Good, how are you?
I'm good.
Nice to see you.
You too. Got some vegetables for you.
Here, Juan says the produce is welcome.
They happy. They get happy to get something free. Yes, I mean, but I'm happy. Yes, for me, like to help them too.
It's a really good reaction. I was a little bit worried that people wouldn't take the produce because I work with some food pantries and none of the fresh food is taken. People don't know how to prepare it or they're scared to do it. But since it's free, I think people are less scared to take it and try to make something new. So it's great that people are getting healthy foods.
Katie will continue to take care of the 2 beds here at Simon G. Atkins Community Garden. Now, these 2 beds should continue to produce into September and maybe even October. At that point, she'll convert over, plant leafy greens and maybe onions, and if the community accepts that produce like they have the first amount she's taken, she won't have any problem sharing that yield and continuing to do her part to fight food insecurity. For Forsyth County, I'm Ed McNeil.
Help emergency responders help you when you can't help yourself. Forsyth Cares. Forsyth Cares, the Community Assistance Registry for Emergency Services, allows you to register yourself or someone in your household sharing health conditions or information that might aid in your care should your home be the subject of a 911 call.
911, what's your emergency?
Operators will see critical information, medications, conditions, or in the case of a wandering child or an adult with cognitive disabilities, places they like to go, or even if they have access to a vehicle. The information is stored in a database only accessible to first responders and 911 agents. Get more information at forsyth.cc/Forsyth Cares. In the moment that your life depends on a fast response, get information to first responders that can aid in your or your loved one's care. That's forsyth.cc/Forsyth Cares.
Back now on Forsyth County Connections, and if you listen real closely, just put your ear up to the TV or however you're watching this. Let's look. Okay, that's a familiar sound, especially I guess, I don't know that we're hearing in almost summertime now. We're here with Rebecca Krapps. She's not making that noise. That was actual noise. And she's Extension Agent for Natural Resources and Environmental Systems in NC State University in Forsyth County. Welcome back to the program.
Thanks for having me again, Jim.
What was that sound we were hearing?
So that's actually the male cicada sound that they make when they're mating. And if you think about, so I actually have some here, a male cicada has an air sac on the inside.
Right.
Very similar to the inside of maybe an acoustic guitar. And they have a membrane that vibrates like the strings on the guitar.
Right.
And then that sound reverberates through that air sac, and they're able to project that sound.
All right, now let me back up just a second, because for those that may not know, what is a cicada? I mean, people see them sometimes. God, it's the hugest fly. It's the hugest horse fly I've ever, because there are horse flies that look sort of like some cicada. What is a cicada?
So a cicada in Latin actually means tree cricket, which is a bit of a misnomer. They're not actually in the cricket family at all. They're in the order Hemiptera, along with stink bugs, bed bugs, things like that. So it is an insect, but it's not related to the fly directly.
Do they bite you if they land on you, or?
No, there's no concern. They actually are liquid feeders. They have special mouth parts that allow them, when they're nymphs underground, they use their mouth parts to just draw liquid out of the roots of a tree.
Right.
When they're adults, they do the same thing from tree branches. They draw out the food that they need from trees.
Yeah,
So they can't bite. They don't bother crops or pests, pets or anything like
Well,
that.
now you emailed me one day and said, Jim, there are actually 3 types of cicadas. So what do you mean?
Yeah, so there's the ones that we see here each year, and again, these are a little bit larger, the ones that are a little bit more familiar to most people. Those are our annual cicadas, often called dog day cicadas because they do come out during the dog days of summer,
Right.
When it's a bit hotter outside. And then we've got 2 different periodical groups of cicadas that a lot of people may have seen in the news this year that are emerging. There's one group of periodicals, the 13-year, so that brood's been underground for 13 years completing their life cycle.
Right.
And then there's also a 17-year brood that will be emerging this year as well.
Now, what can folks who live in and around the county, what can they expect as the cicadas begin to emerge?
Yeah, so there's several things that people can expect. First, we are only getting the 13-year cicadas here in our area, in addition to our standard annual cicadas. So the 17 years that are in the news a good bit right now are not in our geographic area. There's a small area of Illinois where those 2 groups overlap. So we'll expect the 13s in mid to late May, and then our annuals during the summer.
Is there anything that we should be concerned about? I mean, if people are watching, you've been on a lot of media interviews and stuff, so I'm sure people are getting more aware of this, but is there anything we should be concerned about?
Not really. For people that are uncomfortable around insects, there's certainly going to be a lot of them for about a month and a half. They don't have there's no concern for anyone that has gardens or crops that they're worried about. They don't bite humans or pets.
So they're not destructive?
No, and there's no reason really to swat at them or try to get rid of them. There are a few things that homeowners may notice. Increased mole activity is one of them. So moles in people's yards, they like to eat the nymphs as they're emerging, and so mole populations may increase a bit at that time. And then for anyone that has young trees that they've recently planted, they may want to cover those in some kind of garden netting just to protect those, because the females do cut into the tree branches to lay their eggs. An established tree can handle that just fine, but a younger tree may be impacted by that.
And I don't mean to offend you since you know about these things, but do cicadas serve any kind of useful purpose?
Actually, they do. I get asked that a lot. So they are great for aerating soil. People pay landscaping companies a lot to do that for them.
Absolutely.
Cicadas help that process along naturally. They also serve as a really great food source for birds, small mammals, and so those predators see an increase in their food supply when cicadas have emerged.
Right. Yeah, I know that I can tell because you're really into these kind of things, and you're an expert in it. What gratification do you get from trying to make people aware of these things? What do you get out of it?
I think the most important thing is that people have accurate information. When we see something new or different, especially given the size of these insects, it can be terrifying for some people. And especially with that double brood emerging this year, there's a lot in the media. So I think just helping homeowners know There's not anything to be concerned about. This is a natural process that happens. We actually have them every year, the
Right.
annuals. And that there's nothing to be concerned about in terms of bites or gardens.
Yeah, well, we appreciate you doing what you're doing. You want to give a quick website or anything in case people want more information?
Sure,
or
yeah.
what?
So on the Forsyth CC website,
Okay.
up underneath departments, NC Cooperative Extension.
All right, Rebecca, I appreciate it. I really do.
Yeah, absolutely.
Thanks for making us more aware of this.
Certainly.
And if
Thanks
I
for
hear-
having me.
If I hear those sounds, I'll know what it is now. We'll be right back after this.
Forsyth County has children from birth to teens, single children, and sibling groups looking for a brighter day that can only come from being paired with a foster family. Across our community, there are children who live under the dark clouds of abuse and neglect who end up in the care of the Department of Social Services. Open your home and your heart. Help our children discover a brighter day. Call 336-703-2445 or online at forsyth.cc, search Foster and Adopt.
This is what too much sounds like. This is what stress feels like. And this is what help feels like. If you've lost a job, worry about your next meal, or have trouble making it through the day, we can help. Text STRESS to 211-211 to find a solution.
Back now on Forsyth County Connections, and we have a special guest who's been with us before, and we're always glad to have her here. Unfortunately, sometimes we're talking about very serious things and a serious problem, opioid abuse, but Annie makes it all clear for us, and she's doing a great job in working to battle that. Annie Vasquez is here. She's substance use health educator in Forsyth County under Behavioral Health Services. Good to see you again.
Thank you. Thanks for having me back.
Your office has undertaken a special project related to opioid use. So what is it and how did it come about?
Yeah, so it was a team effort between us and Matt Forsyth, and what we did is we took some raw data that we collected from EMS that talks about overdoses that happen in Forsyth County, and what Matt Forsyth was able to do was kind of analyze that data and put it in a very clean, user-friendly map so folks can see what kind of overdoses are happening, where they're happening, who it's affecting, and it's very easy to use. So it doesn't look like tables and charts and you're not sure what's going on, but it's an actual map.
What population, and maybe you can't pin this down, I don't know, what population usually is most likely to suffer an overdose?
So that's the thing. It affects everyone.
I was assuming at first it'd be elderly people like me,
Yeah.
but you're saying it's anybody.
It's anybody, but I was surprised by the elderly numbers. We see folks as old as 98 overdose. Some of it is illicit drug use, but a lot of it, we believe, is prescription meds, where folks forget to take their meds and they take it again and maybe a third time in a short period of time.
It's hard to remember that stuff.
It is. It's very hard.
Were you surprised by any of the data necessarily? Or?
I think the biggest surprise I had was the number of youth overdoses we're seeing. So when we looked at it, youth overdoses are doubling every year for the last 3 years. So I think we had almost 100 last year. If we double that number, that's almost 200 youth under the age of 18.
Youth overdose. You know, I know this sounds like a trite question, but why? I mean, can you pin down why this is happening? Is it just, because even if there's more, drugs floating in from, South America or something, you still say, well, but the use is up. Now, what's going on?
Well, I will tell you this, with the youth, most of it is over-the-counter drug or prescription drug use. So it's really important for parents, grandparents, aunts and uncles to make sure you're locking your meds, because your kids can get a hold of them and overdose. Even things you don't think about, like cough syrup, Tylenol, Benadryl, any of those things that you may think is benign and not a big deal.
Much less pain meds. If mom is on pain meds, the kid goes in there, gets that, and then does a bunch of cough syrup.
Yeah, and we're seeing lots and lots of alcohol mixed in with that. I'm going to do prescription meds and add alcohol into it, which just heightens that response.
What, with all this new mapping and this data and everything, what do you hope the community learns from this project?
I hope they learn that overdoses is affecting every part of the city, every part of the county, everyone. It's not a them thing, it's a us thing, that it's happening right here in our own backyard, and it's happening in your own backyard too.
What's the, I was going to say the easiest or most accessible way that somebody can get more information about getting assistance if they have a substance abuse disorder or somebody in their family does? What should they do? Is there a particular website? Is there a particular phone number? What?
Yeah, so they can always go to our Frost website through the Health and Human Services website for the county. But we also have what's known as the Behavioral Health Urgent Care, and that's on Highland Avenue, and that is an urgent care for behavioral health needs. Just like if you break your arm, you go to an urgent care. This is if you think you have a substance use problem or you're having some sort of mental health problem. You can go there 24/7 and they'll be able to help you and assess you.
Wow, and tell me again where that's located?
It's on Highland Avenue.
Highland Avenue.
Yeah. So
And you just walk in?
You just walk in and it's 24 hours, 7 days a week.
Let me, before we lose time, I was just curious. What gratification do you derive from working on a project like this? Is there any personal satisfaction you get from it?
Of course. I think one thing it is that to get the information out there. I see the information every day, but it's nice to be able to get other people to do it. And if we can change this in any way through this project, it's 100% worth all the work.
Well, bless your heart for doing it. You're a great person, and you do a great job, you and your team, and hopefully we can lick this thing.
Yes.
Going on there. Thanks, Annie.
Thank you.
We'll be right back after this.
Unlike other health concerns, mental illness is not always easy to see.
D-E-P-R.
Mental illness doesn't show up on a scale.
Bipolar?
Sorting out a mental health concern takes professional diagnosis and treatment.
Anxiety. I thought so.
If you or a loved one has a mental health concern, don't go it alone. For 24-hour free and confidential information and treatment referral, call 1-800-662-HELP. Learn more at samhsa.gov/support.
Every year, 4.5 million young adults between the ages of 18 and 24 visit the ER.
It's every parent's nightmare.
Umergency gives you all the tools you need to quickly and effectively manage your family's emergency. Umergency provides instant access to vital resources, customized to your student's campus and local community, digital consent form, and built-in urgent alert button. Umergency gives you peace of mind when you need it most. Download your Umergency app now.
Back now for Forsyth County Connections, and I would say we saved the best till last, but that might insult our other guests. But I will say that this lady is one of my favorite people. Elizabeth Campier is CEO of Kaleideum, and she is here to talk about all the great things that are going on at the new facility. Welcome.
Thank you so much for having me.
Remind us what it's all about.
Really, when we were trying to decide what we wanted to do for Kaleideum, we wanted to create an experiential learning museum for all ages in the heart of downtown Winston-Salem. And because we had great partners like Forsyth County, as well as a lot of help from the state and private individuals across this community, we have finally been able to realize that.
Now, the nuts and bolts of it, you really needed, one way or the other, you needed a new facility, right?
Mm-hmm. So in 2016, we merged the Children's Museum of Winston-Salem and SciWorks, thinking that we could create 1 + 1 = 3.
Right.
And through all of our work, we did that. SciWorks had already been looking at a way to move downtown. The facility was aging. There was a lot of deferred maintenance. There needed to be some changes. The Children's Museum was looking to grow. So coming together and creating this space in downtown really met both of our needs, and we hope is a win for the community as well.
Now, just for people that on the outskirts of the county, maybe even live in Guilford or somewhere else, what's, you don't have to give the exact address maybe, but what is it near? Give me a landmark so people will know where you are.
Well, it's so funny you say that, because what we wanted to do was create an iconic building in downtown. So what I can say to you is look for the white building with lots of pops of color that looks like confetti or a kaleidoscope coming at you. But it is on 3rd Street, so right near 4th Street, right off in case you want to get some dinner or some food, spend some time with family, visit some stores and do some shopping, and also visit Kaleideum at the same time.
Now, how did the grand opening go?
It was fantastic. We were so excited and overwhelmed by the number of people that came to visit. And so far, we've been really busy on weekends.
Now, I was not there, unfortunately, but I heard that there were drones there and there were robot dogs.
That's right.
Now, is there some kind of partnership you have in place with people to do robot dogs or something? What's that all about?
So at Kaleideum, one of the major initiatives we have, thanks to a grant, is really focusing on robotics and engineering education. So we have a lot of robotics teams that come and practice for 5 or 6 months of a year, building their robots, going to competitions. We're doing that type of programming all the way starting with preschool doing it on the floor, doing camps, doing lots of things. And we wanted to make it a little bit different. That's just the way Kaleideum works, right?
Yeah.
So we thought, what could be better than having have our ribbon flown in by a drone and then have robot dogs to unfurl the ribbon and then
Wow.
allow us to cut it.
And you don't have to clean up after a robot dog, do you?
That's true. Maybe they're the best kind.
That's right. I have 3 dogs, and I can tell you, I wish they were robots sometimes. Rooftop Adventure is supposed to be opening soon. What the heck is that all about?
Well, it's one of the first and only in the entire state of North Carolina to have a rooftop playground. We're excited to be able to get it open. It will offer the opportunity for Kaleideum to be a rainy day and a sunny day destination. Get a lot of your wiggles out with lots of climbing, lots of play, lots of risk tolerance to see if you can push yourself.
You know, one thing that people talk about when they say something's downtown, in any downtown area, they say, well, what about parking? Now, is it going to be a scary thing, or is parking going to be available, or what?
So one of the things, obviously, here in Winston-Salem, on the weekends right now, everything is free for the most part. So we
Right.
encourage people on the weekends to take advantage of that. We have worked out a partnership with the Liberty Plaza parking deck, which is located just directly behind the museum. So you can get your pass for a little bit cheaper. You can get it for a discounted rate if you buy it through the museum. And we're encouraging people to park there. It's a close walk and real easy to access.
Now, let's talk about cost and things. That reminds me, should folks purchase tickets online, or what's the best way to do that? If you say, well, I'd like to take the family down to Kaleideum, what should they do?
We do have walk-up visits, but I will say that we do get busy sometimes on the weekends. So I would encourage folks that can to please go and buy your tickets online, particularly for weekends. You can do that at kaleideum.org, and it allows you to know what kind of programs and events are going on, but also to get those tickets, which will guarantee you a spot in the museum.
Can people still be members?
Absolutely. We love to have members of the museum. Membership will get you in all the time for free.
Okay.
We have lots of different levels. We even have a level now that offers parking with it. If that's something that you want to go ahead and roll in and know that you've got your parking taken care of.
If I'm a member, can I take one of the robot dogs home with me?
I wish you could. We're going to have to learn to bring them out to play a little bit more, though.
I know it. Now, give the website again.
Kaleideum.org.
Kaleideum.org. Hope you'll do that. Thanks for doing this.
Thank you for having me.
Of course, we've had a great show, lots of great guests today, and I appreciate the viewers hanging with us on this. I want to thank, of course, Ed McNeil, our executive producer, Dudley Watts, county manager, who's a short timer. He's going to be retiring soon. We thank him for helping to get the show started, and of course, Jeff Fabrizio, who takes care of putting everything together. And I'm glad you could be with us, and we'll see you on the next edition of Forsyth County Connections.